Welcome to X-ray Review. In this video we're going to go through multiple different examples of benign uterine fibroids or leiomyomas. So don't forget to like and subscribe, and let's look at some uterine fibroids. So uterine fibroids or leiomyomas are going to be found in females. They're the most common solid benign uterine neoplasm. They're usually going to occur in the uterus, but they can occur anywhere that has smooth muscle. And when they do occur, they're usually multiple as opposed to solitary. And while they may look alarming, typically the radiographic finding is incidental unless the patient is younger and trying to get pregnant, complications with pregnancy. That's when these can be clinically important. And there can be rare complications, but typically speaking, there is no reason to advance to advanced imaging such as CT unless there are clinical red flags or it is a younger patient trying to get pregnant. This is a 57-year-old female with two large uterine fibroids or leiomyomas in the pelvic basin. And it's important to make sure that these are in the pelvic basin in the soft tissues and not arising from the sacrum. So we can see the anterior border of the sacrum and then the abdominal calcifications being those uterine fibroids. So the delineation here, we know it's not coming from the sacrum. We can exclude any type of rare thing like a chondrosarcoma, and that is very important to remember. This is a 32-year-old female with a large uterine fibroid, and when there is need for a medical referral, a gynecological consultation is appropriate. This is a 62-year-old female with multiple uterine fibroids or leiomyomas. Here's an example of a large solitary uterine fibroid in a 54-year-old female. Here is an interesting presentation of multiple leiomyomas, and this individual did end up having CT due to clinical complications. Here is a very large example in a 49-year-old female. This is a 33-year-old female with a large uterine fibroid. Sometimes the mass-like calcification is not peripherally calcified, but instead you'll see this heterogeneous punctate or spotty calcification, and still a benign uterine fibroid or leiomyoma, but it can present a little differently radiographically. This 46-year-old female has multiple uterine fibroids, and we can clearly tell in the lateral view that these are far anterior in relation to the sacrum, so we're not concerned about an expansile aggressive sacral lesion. This 37-year-old female has a thin-walled, mass-like abdominal calcification in the pelvic basin, and that is consistent with a benign uterine fibroid. These densities begin to mimic large bladder stones, but these also represent uterine fibroids. Here is another example in a 48-year-old female. Note there are also two other calcifications in the right upper abdomen, and these are consistent with gallstones. This 70-year-old female has multiple pelvic calcifications, as well as some pretty severe bilateral femoroacetabular arthrosis. This 55-year-old female has a uterine fibroid in the pelvic basin, as well as two other atypical densities in the expectant area of the kidneys representing staghorn calculi. And here is another example in a 56-year-old female. And here is one more example of a uterine fibroid overlying the sacrum. Alright, well hopefully you enjoyed looking at these multiple examples of benign uterine fibroids or leiomyomas, and if you did, please like and subscribe, and any questions, please put them below. Thanks again.